Hey everybody, Erica here with One Berkshire, and I am live for another Women in Business interview, and I'm here with Lia Spiliotes, who is the CEO of Community Health Programs, CHP. Say hello.
Hello everybody, welcome to our South County campus.
Yes, here we are at the South County campus. We're going to do a little pan around here. So what are they seeing right behind us?
What you're going to see right behind us is our Great Barrington Medical Facility. We have actually 9 locations, if you can believe it,
wow,
across Berkshire County. The furthest north is North Adams. This is the furthest south. We have dental in Great Barrington as well. And then we also have obstetrics and gynecology also in Great Barrington. So we've got 9 locations across Berkshire County, which is probably one of the largest health networks around.
Definitely, and across the Berkshires. And there's another part of your business that some people might not know about.
Probably you don't know about what's family services over here in the blue. We call it the blue building and family services.
We're going to turn, but I think you're going to see the sun, so we're just going to walk towards it so we don't have the sun in our eyes. We're going to go into the family services building because when Lee and I were talking about what would be a fun backdrop for this video, we were thinking what's more fun than being like with toys.
It's where all the toys and the kids are.
It's the fun stuff. So here, I'm going to turn around so you can see it. Here, Leah, stay with me here.
Okay.
So this is what the family services building looks like.
We call it the blue building.
The blue building.
And in it is our WIC program. It's our parent-children program. It's breastfeeding. It's nutrition. It's energy. It's basically all of those social determinants of health that are important in maintaining a healthy family. And we can go inside and you can actually see it.
Yeah, let's do it. I like the holistic approach that you guys are taking to this whole thing.
Well, we have pretty much every single specialty that you could ever want in our organization, including vision therapy, physical therapy, obviously nutrition therapy. And so this you can see.
Yeah, so let's pan around and get this thing. I'm going to take you with me here. So you'll notice there's all kinds of services in here. You tell me, what are the services that are in here?
Well, so this is actually where we have our play groups, and this is where we have the parent children's program in here. We also have clothing.
Books. Yeah, I see clothing. I see books.
Books and clothing exchange. We also have a food program. We not only do the food bank, but we offer food here for individuals who want to come get bread, get vegetables, get whatever. So it's pretty much full service. Anything that you can think about that would have an impact on a family, we do here.
Nice.
Which is great.
So I want to talk about you.
Yes.
So you're an amazing woman and business leader here. You are the CEO of this organization. How the heck did you get here?
So I came here 3 years ago, actually, as an interim. Okay. I have sort of a history.
Yeah, tell us your history.
I actually started as a research scientist many, many years ago. I'm 61.
Okay.
Research scientist many, many years ago. I went to business school and I transitioned into the healthcare arena, and I've been in it for close on 40 years.
Wow.
And my whole business was to go into organizations and get them on steady ground, turn them around, and then help them find management, and then leave. I came here.
Well, when you said your business, were you doing that as an entrepreneur?
I was doing it as an entrepreneur.
Oh, okay.
And so basically I came here and decided that I liked it so much.
That you would stick around.
That I wanted to stay. So I threw my hat in the ring. And I was fortunate enough to get the permanent position.
Excellent.
So I'm very excited to be here.
Welcome.
It's a great organization, and I believe my sort of vision for the future for this organization is for it to be a national model of healthcare.
Wow.
Primary health care is really the direction that this country's going in.
Yes.
And we are leaders in that in Berkshire County, and there's a lot more that we can do. And I'm excited to be running an organization of such talented people, and to be able to do this kind of thing is really a dream come true, to give back.
Awesome. And like you said, for the rest of the country, then to be able to look here as a model for how do we tackle healthcare.
Exactly.
So cool.
Exactly.
All right, so talk to me about this path that you've taken to get to this place. Have you run into any challenges along the way where there's been a lesson you've learned that we can benefit from kind of hearing about?
As I said to you before, given my age, I've had quite a number of them, but I'll tell you one that is particularly interesting to me, which is my boss's boss asked me to fire my boss.
Oh boy, that's interesting.
I was pretty young at the time.
Wow.
And it was a challenge. I was running a small piece of a large business, and it taught me a lot about compassion. And I really believe and espouse a model of leading with compassion. You want to see what other people see, you want to feel what other people feel, and you want to lead with your head and your heart at the same time. And that experience taught me greatly, because I put myself in his shoes to be in the situation he was in, which he probably never should have had to be in the first place. But I did it, and we've actually ended up becoming lifelong friends.
Ah, because you did it with such grace and compassion that it didn't feel awful.
Exactly.
Oh, good for you. That's a great lesson.
Exactly.
Fantastic. Okay, so I want to tap into more of this wisdom that you have to share with us. Put on your mentoring hat. Give us more of this. Give us some more. What are other words of wisdom?
I like to quote from the Buddha.
Yes.
And
Good.
the Buddha says, "Know what leads you forward and what holds you back, and choose the path to wisdom." And I think that's very important, because most people really focus on what holds them back. It's like when you make business decisions, you really focus on all those things that you think aren't right about something, as opposed to focusing on what is right about it. And I think for people to really know what leads them forward, which takes a lot more introspection, I think, is important. So I tend to ascribe to Eastern philosophy, and that's always been meaningful. As a matter of fact, it's in my office on the wall.
Oh, wow.
Yeah.
And so would that translate into knowing what your strengths are, and then trying to put yourself in positions where you're really getting to maximize what your strengths are?
Exactly. And, and being willing to take risks. I think what's very important is there might be a lot of people out there who'll try to hold you back, and you know what you want to do, and you have to have the confidence in yourself to do it. So you need to push yourself forward despite what anybody says, and go for even what you think is the most impossible thing. Go for it. I never thought when I was growing up in the business world that I'd ever be CEO of this kind of an organization, and yet here I am.
You are.
A number of years later, sitting in the seat and being able to be part of something that's bigger than myself. So it's pretty cool.
Yeah, well, and that shows that some of the skills you've picked up along the way have translated to this moment right now.
Right, exactly.
Very cool. All right, another question I've been asking people is, with you being an inspiring woman in business leader in the Berkshires, who are some of the women in business in the Berkshires who inspire you?
Well, there's one person in particular, and again, I'm sort of new to the area, so I don't know that many women, but the one person who's inspired me is Darlene Rodowitz, who's the Chief Financial Officer at Berkshire Health Systems. And
Excellent.
she's this uncanny blend of understanding the industry and the nuances of the industry and the finances, and real, what I would say is heart. And she is atypical for somebody who really is a numbers person, in that she really does kind of get the much broader issues in healthcare. So I would say I work pretty closely with her. Great. And I would say that she's been a real inspiration for me.
Awesome.
Yeah.
That's a great one. So you're meeting the right people already.
Yes.
And I guess I'll just end with, did you have anything you want to promote or shout out? Like, what's coming up for CHP that the people might want to know about who are watching this?
Okay, so...
And who the heck is this?
Here it is.
Ah!
Here's a
Wait,
scary...
we kind of look alike. We have the same hair, I think, me and this
scary
this
clown.
little dude.
We have Haunted Hills coming up this evening. For those of you who are 13 or over, it's when it gets dark out. And it's right here on the CHP South County campus, the far end of the parking lot. So definitely come, check it out. It's going to be really ultra scary.
Ultra scary haunted house. And is it tonight only?
It's tonight only.
Oh my gosh, do not miss this.
One
Tonight
night.
only. If you are 13 or up, and does that mean adults too would probably get scared?
Yes.
Yes. All right. So this is for everyone watching right now. Come on out to the parking lot of CHP one night only to get scared by this guy and many other creepy things, I'm sure. All right, Leah, put that down. All right. So is there anything else, just as we're signing off here?
No, I just want to say that this is a great community, and we are very fortunate to have not only collaborative partners in business, but also individuals and families and patrons of CHP. And so I'm always grateful every day for those folks who step in and help us out,
Awesome.
as I am for the staff of the organization.
And we're also fortunate in the Berkshires to have amazing women leaders like yourself. So thank you so much for being on our interview today.
Thank you very much.
And happy Friday, everybody. We'll see you again on the next one. We got a couple more left in October, and then we'll be done with Women in Business Month. So say hi next time. And here's signing off, Erica and Leah. Bye.
Take care. Bye-bye.